Hello, my name is Dr. John Perea. I'm a chiropractor here at In A Flash Chiropractic in Denver, Colorado. Our main mission is to provide high quality chiropractic care to help people's bodies perform better and to help them reach their individual health goals. Now, most people think that you have to be hurt or injured in order to need to see a chiropractor, and that's not true. Healthy people and people of all ages are able to see a chiropractor and can see benefits from seeing a chiropractor. I adjust people of all ages. I adjust kids, adults, elderly, pro athletes here in town, all in between. People of every activity level can benefit from adjustments. Chiropractic helps restore and maintain good nerve flow throughout the body. If you've ever studied anatomy or physiology, you know that your nervous system is the master system of your body. It controls and regulates all the other systems. Every cell, tissue, muscle, and organ in your body are regulated and controlled by the nervous system. Now, when we're talking about the nervous system, we're talking about your brain, brainstem, and spinal cord. That's your central nervous system. That is your lifeline. Your brain is your control panel, and your brainstem and your spinal cord is basically the lifeline which connects your brain to the body parts. And thousands of messages every minute are going to and from the brain, letting the body know what to do and telling the brain what the body is doing in order to maintain homeostasis and basically regulate normal activity throughout the body. When our bodies are properly aligned, our bodies are able to protect the spinal cord, it's able to absorb shock properly, it's able to self-regulate, self-maintain, self-heal, and self-repair without external help. That's what's written into our DNA. Our bodies are able to take care of themselves and be self-sufficient. And that's fine and that's awesome if we lived in a perfect stress-free world. But guess what? We don't. We have tons of different stresses coming at us all day, every day. And they come in the form of mental stress, physical stress, and chemical stress. Now, these are considered thoughts, trauma, and toxins, which are basically destructive forces working against your body. Now, these forces can cause misalignments and cause your body to get out of balance, which alters nerve flow. And when you have a segmental misalignment, it puts pressure on your nerve flow, which blocks information. So when you have this buildup of information and this blockage that's causing an information traffic jam, it's not necessarily going to cause pain right away. It's going to be interfering with signaling from the brain. So basically, it's going to be interfering with everything that nerve is telling the body to do. Now, we've already established that the nervous system is the master system and it controls all the other systems and everything that the body does. But mainly what it does is interfere with motor nerve control. Now, if we have an irritation or excitation or stimulation to some of the motor nerves that are interspinal nerve root coming out of your spinal cord, basically what it's going to be doing is causing an overactivation or an underactivation of some of those nerves, causing muscle spasm, muscle tightness, muscle guarding, or muscle weakness. Now, that's usually the first symptoms that somebody will normally experience when they're having nerve blockages. Secondary symptoms will be irritation to the autonomic nerves. The autonomic nerves are the ones that control your organs. Now, you may be experiencing systemic or any internal malfunctioning of your body due to these misalignments. And then lastly, the third component of your spinal nerve root are sensory nerves. Now, those are the ones that control your senses, your sight, smell, hearing, touch, and taste. If you have irritation to your sensory nerves, most of the time people experience it as a pain. So typically you don't start having pain until that nerve is blocked 50%. So most people come in, obviously when they're in pain, and that's understandable. But pain is usually the last thing to show up when you have a nerve being irritated, and is usually the first thing to start going away once you start getting treatment. So when we start evaluating a typical patient for misalignment, most people come in when they're in pain. So we'll obviously look at that area, but that's not all we're limited to. We don't do spot treatments. I'm not just going to look at one particular concern of yours. I'm going to be looking at the full body, the body as a whole, because everything works together. And also, we're not using pain as an indicator whether or not you need an adjustment. One of the main things I tell my patients is to not use pain as an indicator whether or not they need an adjustment. Obviously, it's better to get regular adjustments and build up your balance and build up your alignment, so that way we improve communication between mind and body and improve the internal neurological communication within your body, because that is where all your healing comes from. We have an innate intelligence that is designed to self-heal and repair our bodies. And when our bodies are connected neurologically, free of interference, our bodies are able to heal. That is our goal, to maximize nerve flow and reduce any neurological interferences that could be affecting our health. Oftentimes people report improved muscle strength, better coordination, improved sleep, improved digestion, improved rest, improved immune system. During your first visit, when you come in, you'll have a little bit of paperwork. Fill it out, come on back, we'll do a consultation, examination, and correction, looking for any areas in your body where your nerve flow might be hindering your expression of true life and your expression of health in your bodies. In general, most people look forward to and love getting adjustments and leave feeling taller, lighter, breathing better, sleeping better, and more energy and less pain. Now you know what to expect on your first visit when you come here to Back in a Flash Chiropractic in Denver, Colorado. I'm Dr. John Perea, and look forward to meeting you on your first visit.